This week we will continue our discussion of information technology by exploring clinical decision support systems. These systems are required by the American Recovery and Reinvestment Act of 2009 and support patient safety. Clinical decision support systems function to efficiently alert healthcare providers when a patient's physiological parameters are outside the accepted normal range. They consist of input from the electronic record, a reasoning engine, a knowledge base, and an output in the form of a clinical alert. For most clinical decision support systems, information is entered into the system. This information may be demographic information about the patient, their vital signs, medications, or interventions. The system has a preset group of accepted values for laboratory findings, vital signs, or other items that may be selected from a drop-down menu. Once the information is entered, the system recognizes the information and the reasoning engine works to identify potential outcomes that relate to the patient's information with evidence-based practice guides and pre-adopted normal values to create a clinical alert specific to this patient's situation. Many things contribute to the idea of garbage in, garbage out inaccuracies found in electronic documentation. The complexity of the work environment and poor workflow patterns contribute to a rush to document missing or inaccurate data entry. Another concern are the restrictions created by requirements to use a standardized terminology that may prevent accurate input of information and communication of sudden changes in patient conditions. One solution to this last problem is currently being researched using natural language processing, which is a method of taking free text and analyzing it for patterns and added meaning to create added rules and more individualized patient-specific alerts. The text shows the common clinical decision support system applications and gives examples of patient safety rules that support safe care. Clinical decision support system applications are designed for specific purposes. Essential to their effectiveness and safety are the construction of key decision points and inclusion of the right information to be useful as a tool to support clinical decision making. They must be programmed to recognize abnormal information, but still require the knowledge of a clinician to make appropriate decisions based upon the alerts to these abnormalities. While alerts are built from rules and knowledge of normal findings, if the provider resists or ignores the alert, an error or delay in care can occur. In summary, clinical decision support systems impact patient safety and have an impact on nursing practice. Dependence on the alert or ignoring the alert may negatively impact nursing decision-making and lead to errors. Nurses have a vested interest in the development, education, and implementation of system alerts to guide clinical decision-making and improve the quality and safety of patient care delivery.